Hello, welcome back to the Golden Canopy Health Management channel. My name is Kevin Lee, and today we're going to be talking about original and traditional Medicare. Now, there are many different options when someone is turning 65 and they need to know which direction to go. One of the options is original/traditional Medicare. They can be used interchangeably, but for this purpose, we'll use them as original Medicare and traditional Medicare. So what is it? Original or traditional Medicare simply is Part A and Part B, right? So Part A and Part B is traditional or original Medicare. It's called that because when Medicare originally came out, those were the options that you had. So we have since added some new things to Medicare in the Medicare arena, hence the original/traditional Medicare. So that covers Part A and Part B. Now there are lots of advantages to having traditional or original Medicare. Some of the advantages are your health will be discussed between you and your doctor. So there isn't someone else in that conversation. Another benefit to having original or traditional Medicare is that you can travel anywhere in the U.S. and any hospital clinic who accepts original Medicare, you'll be able to get coverage and be seen there. The good thing is 95 to 98% of hospitals, clinics across the country will accept traditional and original Medicare. Also, you don't need to inform, say, your insurance company when you decide to move, say, from Missouri, where the winters are pretty brutal, to Arizona, where the winters are quite wonderful. So there's no need to reach out to someone and explain that. So later on, I'll go over what Part B is, what Part B covers. I'll also go over what Part A is, what Part A covers, as well as Part C and as well as Part D. But for right now, the advantages of having original or traditional Medicare is you will remain control of your health between a conversation between yourself and your doctor. You can go see a doctor, clinic, hospital, anywhere in the country who accepts original and traditional Medicare. If you're going to move, you don't need to inform your insurance companies that you're moving. You can just go and move. Now, there are disadvantages to having original Medicare as well. Original and traditional Medicare does not automatically come with Part D prescription drug coverage. It does not automatically have vision coverage. It doesn't automatically have dental. It doesn't automatically cover hearing aids and hearing loss. So all those things are additional to Medicare or original and traditional Medicare. Now, that's not to say you can't get it. Of course you can, because there are products like Medicare Part D plans you can also buy. But as a general rule, original Medicare and traditional Medicare or does not come with those things. Like I said, in later videos, I'll go over what those components are to make sure you have all the options as well. So with that being said, if you wanted to see an eye doctor, if you wanted to go see a dentist, if you wanted to go check your ear, that'd be a completely different Medicare product that you would have to add in addition. Another disadvantage to having original Medicare and or traditional Medicare is that there's no limit to what you pay out of pocket for copays. There is no stopgap to not being charged whatever it is. So although sticking with original and traditional Medicare is an option, I wouldn't say it is the best option for most people. If you wanted to have an additional coverage, say dental, vision, hearing aids, things like that, there would be an additional cost for it. But I just want you to understand and to know what original Medicare is. Original Medicare simply is Part A and Part B. Original Medicare does not provide hearing or vision or dental coverage. Original Medicare and traditional Medicare does not protect you from being overcharged for copay. Original Medicare also doesn't provide prescription Part D already included in it. So those are the things that you need to know. But anytime you hear Part A and Part B, that's just original or traditional Medicare. The advantages are, once again, your health is discussed between you and your doctor. You can go anywhere in the U.S., in U.S. territories, to see a doctor or hospital if they accept original and traditional Medicare. And I'd say about 95 to 97% of all clinics, hospitals across the country will accept original and traditional Medicare. Another advantage is if you want to move, you don't have to reach out to any insurance company and inform that you're moving. The disadvantages of original and traditional Medicare are you won't automatically have vision, dental, or hearing coverage. You won't automatically have Part D prescription drug coverage. And you aren't protected from being charged more than 20% for copay when you go see a doctor or a clinic. Now, there are things in place that you could add additional protection for your original traditional Medicare route. But I just wanted you to know that that is an option for anyone who is turning 65 and getting ready to step into the Medicare arena. Going the original and traditional Medicare route is an option. Next, I'll cover, Medicare Advantage, and of course, Part A, Part B, Part C, Part D. But I just wanted you to know that Medicare or traditional and original Medicare is an option that one can choose to manage their health. Now, you can reach out to Golden Canopy to walk you through exactly what that process is, what it looks like to go through that process. I'll also cover MediSup as well, but we'll do that systematically and in order. So this will be more digestible, easier to understand, easy to explain. Thanks so much for, once again, watching the Golden Canopy Health Management channel. Stay informed and see you next time. Bye-bye.